So as we begin, I would like to go ahead and give the mic over to Dr. Wesley Willeford, who is the Director of Jefferson County Health Department. And if you will, just give us some COVID-19 updates. Thank you.
Thank you so much for the opportunity to be able to speak. It's always an honor to be able to reach out to the public. And, I want to start off by saying that where we are in Jefferson County at this point, we are seeing fewer cases overall than we did earlier on back in the very late part of March, very early part of April. However, we still have some cases that are circulating in the community. And I think it's important just to restate the fact that this virus is that there is no immunity in our community to this virus. And what that means is that the virus, if it encounters someone, if someone comes in contact with the virus, there's nothing that stops the virus from infecting them. So it's a very infectious virus. Plus, no one has any protection against it because we don't have an immunity to it. So that no one can be protected by their own immune system. So that means that it can sort of tear through our community. We've done a good job, though. We've done a very good job of keeping that burden to a very minimum, and that is in large part due to the efforts of our citizens of Jefferson County who have really thrown their all into it to keep their distance from one another. So some of the things that I want to talk about are why this is so important. So when we keep our distance, so we talk about that 6 feet distance, when we keep that distance, that is the distance that a cough, a sneeze, can cause the fluid from inside of our lung, our breathing system to travel. And that means that's the distance that COVID-19 can travel as well. So by keeping that distance, that really decreases our rate of having new infections because of that. Recently, Dr. Mark Wilson here at the Jefferson County Department of Health issued guidance on using face coverings. So, and to be clear, what we mean by that is that can be a cloth, that can be a bandana, that can be a t-shirt even. Anything that covers your face and prevents the spread of those droplets, that is, again, it doesn't protect you so much as it protects your neighbor, because it slows down the spread of the virus if someone was sick to the people that are around them. So that's why we're encouraging people to use face coverings when they're out in public. The other thing that we want to talk about is, it's still very important to try to limit your trips outside of the house and limit your contacts to really just those people that already live in your home. So, if you've got mom, dad, a son and daughter at home, you don't really want to go beyond that circle. You want to keep those people together. If you start going out to see friends, if you go see, or if the children go out to play with other children, it creates more opportunities for the virus to spread and bring back to the home and cause illness. But in all of that, I think one of the things that people wonder about is, well, things seem very restrictive right now. I know a lot of people have cabin fever, and I know that, it's hard sort of being isolated from people. I know myself, like I was planning to go back to see my mom this spring, and I haven't had a chance to do that. And I talk to her every day, but it's just not always the same. But we've had to change how we communicate and what we do. And that's something that I want people to be as creative as they can about. We have a lot of technology at our disposal now, much like this, where we can see people even though we're not physically together. But some of the things to help break up the monotony and break up the challenge of all of this is like, please feel free to sit outside. It is perfectly okay to go out and enjoy this when we've got nice sunny weather like this, to enjoy that weather, to enjoy the cool air. You just want to make sure that, if someone stops to say hi, that they're keeping a good distance and they're not coming up close to you, but really just want to avoid those contacts outside of your home. Please feel free to go for a walk, be able to walk around your neighborhood. You just keep your distance from people, because we want people to get exercise. And we also want people to get some sunshine, because it just helps you feel better and helps us get us through this a little bit better. And also, for those people who have pets, I mean, it's a wonderful opportunity for your pet to get some exercise, and also just to, have some bonding time with your animals. The things that we really want people to avoid is, whenever you go outdoors, if there's a large group of people that are congregating, you really want to stay clear of that. Again, that could put you at risk, and certainly could put them at risk as well. And like I was alluding to before, our children, it's really important that while they're not in school at the moment, that they may have a little bit more free time on their hands. And it's really important that they try to limit contact with their other friends outside of the home, because again, that again just gives more opportunities for this virus to spread and come back to the home. And then lastly, is I know one thing that we talk about a lot on our media outlets is whenever you go to stores, you want to make sure that you're doing everything that you can to keep your distance within a store. Most stores are doing a very good job of trying to throttle and limit the flow of people in and out. But you just really want to be extra careful because we obviously have to go to the store, but we have to use a lot of caution so that we don't bring the virus back to our family members. Other than that, those are the main updates right now. But I do want to say one of the things that we're doing in Jefferson County as part of our efforts in controlling coronavirus is what we call contact tracing. And people may have heard about this. Contact tracing is the process where if someone has a positive test for COVID-19, the Alabama Department of Public Health gets notified of that. And then they send that information to us, and we will reach out to people. So if someone tests positive and they have a call from the Jefferson County Department of Health, that's perfectly normal. That's just our normal way of doing business. And what we do, we ask certain questions to be able to figure out where a person's been, who they could have potentially exposed the virus to. Certainly, they didn't expose anyone intentionally, but it just helps us to understand the path of the virus and helps us to track it down and stop further spread. And so that's something that if someone has tested positive, they've probably talked to us at some point. And again, that's part of our efforts to slow the spread of disease. But with that, I'll conclude my comments. And again, I thank you all for the opportunity